Hello friends, this is Dr. Ekant Shekhar. Today we will be discussing a very important topic which is understanding venereal diseases in dermatology. Basically, venereal diseases are also known as sexually transmitted infections and they are basically primarily spread through sexual contact. The infections can affect the skin, mucous membrane and other organs and can cause a wide range of symptoms and complications. In dermatology, venereal diseases are an important area of study as they can cause significant skin and mucous membrane manifestations. And there are different types of venereal diseases which we shall be discussing further. First coming syphilis, which is basically caused by Treponema pallidum and can cause a wide range of skin and mucous membrane manifestations, including chancre, condyloma lata, and gomas. Next, very important is gonorrhea, which is a bacterial infection again caused by Neisseria gonorrhea, which can cause symptoms such as discharge, pain, and itching. There is chlamydia, which is a bacterial infection caused by Chlamydia trachomatis, which can cause symptoms such as discharge, pain, or maybe itching in the genital area. Herpes simplex, which is a viral infection, which can cause symptoms such as blisters, sores, and itching in the genital areas. Human papilloma virus, which is a viral infection that can cause symptoms such as warts, cancers, and genital lesions. So basically, we will be discussing in details all this. Also, the clinical manifestations where if there are genital ulcers, so they are painful or painless ulcers on the genitals, which can be caused by infections such as syphilis, herpes, or chancroid. So that differentiation we need to identify in throughout our lecture. Also, what are the main points where we can diagnose it? So the diagnosis of venereal diseases typically involves a combination of physical examination, laboratory testing, and medical history. Some common diagnostic tests you might have heard of includes dark field microscopy. So that is a diagnostic test used to detect the presence of Treponema pallidum that usually causes syphilis. Also, PCR, which is again an important test, diagnostic test which is used to detect the presence of DNA from specific microorganisms such as Neisseria gonorrhea and Chlamydial trachomatis. There are also serological testing, so that diagnostic testing is used for the presence of antibodies against specific microorganisms such as Treponema pallidum and HPV. Also, very important is the treatment part, which includes penicillin, doxycycline, acyclovir, and imiquimod. And there are other preventive steps which we shall be discussing. There are complications like infertility, cancers, neurological problems, and psychological problems. So, the group of communicable diseases in which sexual contact is the most important mode of transmission. Also, the importance is because there is increasing incidence worldwide, the cost and difficulties in the treatment of the disease and their complications. Also, it is a socioeconomic problem as well as behavioral ones, since it is linked to addiction, low level of religious values, increased age of marriages, etc. As the introduction part, so it is transmitted by wide range of bacteria, viral, protozoal and fungus agents and ectoparasites. STIs are infections that are spread from person to person through intimate sexual contact. These are dangerous because they are easily spread and it's hard to tell just by looking who has an STI. Also, it is important that such dynamic epidemiological changes in STIs are acknowledged and kept track of in a vast and populous developing countries like India, particularly in this HIV era. It is with this aim that there are certain things where the heterogeneity of data to account for the subcontinental dimension of a country like India has been noted. But there is a basic pattern in the changing epidemiology which is discernible. Like the developed countries in India, too, the bacterial STIs like chancroids and gonorrhea are declining, while viral STIs like HPV and herpes genitalis are on an upswing. The overall decline in the prevalence of STIs has to be interpreted with caution. However, this may partially reflect the improved facilities of treatment in the peripheral centers that obviates the need of many patients in attending the STD clinic in the tertiary centers. Also, the improved pharmacotherapy of many of the bacterial STIs may result in partial clearance and non-reposting of many of these infections. Epidemiological determinants. So, agent factor over 20 pathogens are found to be spread by sexual contact. Neisseria gonorrhea is by gonorrhea. For gonorrhea, we have Neisseria gonorrhea as a causative agent. For syphilis, we have Treponema pallidum. For urethritis or cervicitis, we have Chlamydia trachomatis. For genital herpes, we have herpes simplex virus. And then AIDS is HIV. And vaginitis is Trichomonas vaginalis. Host factors include age, highest incidence in 20 to 24 years, followed by 25 to 29 and 15 to 19 years. Sex is another morbidity is higher in men but is much more severe in women. Marital status higher among singles, divorced and separated persons. Socioeconomic status, low socioeconomic status have high morbidity rates. Demographic factors include population explosion, marked increase in young people, rural to urban migration, increasing education opportunities for women for delaying their marriage, and increasing STD risks. Social factors include prostitution, major factors in the spread of STD, acts as a reservoir of infection. Broken homes, promiscuous women are withdrawn, home is unhappy, and children reared in such an atmosphere are likely to go astray in search of other avenues of happiness. Sexual disharmony, married people with restrained relation, divorced and separate persons. Easy money, prostitution is a reflection of poverty. It provides an occupation for earning easy money. Social factors, so emotional immaturity, often stressed as a social factor in acquiring STDs. Urbanization and industrialization, conductive type of lifestyle leads to high levels of infection. Since long working hours, relative isolation from the family, and social mobility causes sexual relationships. Social desperation caused by disasters, wars, and civil unrest. International travel, travelers import and export the infection. Social factors again changing behavioral patterns, more relaxation to moral and cultural values in present day society provides the young in present day society the opportunity to break away from the traditional ways of life. Social stigma which is attached to the STD accounts for non-detection of the cases, not disclosing the source of contact, etc. Alcoholism, effects of alcohol seems to be more indirect than direct. So coming on the definition of venereal diseases, these are defined as disease transmitted through sexual intercourse. These are contagious conditions whose principal mode of transmission is by intimate sexual activity involving the moist mucous membrane of genital areas, mouth, and pharynx with their adjacent skin surfaces. So the STIs they are considered as a common globally impacting public health issue. Rates vary by region and population. Also, more than 25 million sexually transmitted infections occur each year in the United States. Around the world, an estimated 374 million sexually transmitted infections can occur. According to the CDC, there are approximately 2.5 million cases of chlamydia, gonorrhea, and syphilis in the US. In 2021, about half of the cases occur in people which were aged between 15 to 24. So, as a classification, we can broadly discuss it under viral, bacterial, parasitic, and fungal. In viral, we can comprehensively put AIDS, genital herpes, and genital warts. In the bacterial condition, we can put syphilis, gonorrhea, non-gonorrheal urethritis, chancroid, non-specific vaginitis, granuloma inguinale. Parasitic, we have trichomonas vaginitis, scabies, or maybe pediculosis pubis. In fungal, we have vaginal thrush, vulvovaginitis, and balanitis. So First, in this category, we shall be discussing HIV. So, HIV, by definition, it is a viral infection that attacks the body's immune system, specifically the CD4 cells. If left untreated, it can follow to acquired immunodeficiency syndrome, a condition where the immune system is affected and severely weakened, where it is making difficult for it to fight off the infections and diseases. Also, there are two species of lentivirus, a subgroup of retrovirus that infects humans. Over time, they cause acquired immunodeficiency